Good afternoon, everyone, and welcome to the October 18th regular meeting of the Commission to End Homelessness. Commissioner and Chairperson Don Wagner is running late, and he will be with us shortly, so we'll go ahead and get the meeting started. Let's begin with the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Those of you who I have not met, I'm Richard Afable. I'm the Vice Chair of the Commission, and I'll lead until Chairperson Wagner arrives. The agenda for today contains a brief general description of each item to be considered. Except as provided by law, no action shall be taken on any item not appearing on the agenda. The Commission to End Homelessness encourages public participation. If you wish to speak on any item appearing on the agenda or during general public comments, please complete a speaker request form and turn it into the clerk prior to the reading of the item. Speakers will be given 3 minutes to speak. The clerk will run the timer and announce when your time is up. Public comment may also be submitted electronically by email to response@ocgov.com. That's response@ocgov.com. With that, we will move on to the roll. Madam Clerk, will you please call the roll?
Can you please indicate your presence when I call your name? Commissioner Sarmiento?
Here.
Commissioner Wagner? Commissioner Vanderpool? Commissioner Rose? Commissioner Parks? Here. Commissioner Dimitropoulos? Commissioner Cornwall? Here. Commissioner Davis? Here. Commissioner Twan?
Here.
Commissioner Ivins?
Here.
Commissioner Spitzer?
Here.
Commissioner Searcy?
Here.
Commissioner Afable?
Here.
Commissioner Wyatt?
Here.
Commissioner Peineman?
Here.
Commissioner Rios Faust? And Commissioner Morse.
Here.
Thank you, Vice Chair. We have a quorum.
Thank you, Madam Clerk. Just a housekeeping item as a reminder, please be aware that the room is hot mic'd for the live stream of the meeting. Commissioners, please try to speak a little louder so that the microphones may pick up your comment for the live stream. By the way, we now have these wireless microphones. You see there's 2 buttons. Push the button on the right and the microphone will turn red, and we're going to need to share. So if you're going to be speaking, just share the microphone and push the button until it turns red. Please try to keep conversations to a minimum as they may be picked up by the microphones throughout the room. We will now move to the agenda for today's meeting, and we'll begin with our discussion item. Madam Clerk, would you please read the first item?
Item 1 is the Office of Care Coordination update, which includes updates on membership and the cold weather emergency shelter ad hoc. We have no requests from the public to speak on this item.
Oh, go ahead.
So, all right, perfect, no problem. I know I failed on my first attempt with the microphone. Good afternoon, everyone. Thank you again for coming today and to other meetings. We're really excited about today's commission meeting for a whole host of reasons. Like Dr. Afable said, we've put these microphones out. We've heard from folks, especially in the back, who've sat in the back, that they can't hear the discussion. So I know that I always think I have a loud voice, but I'm still going to use the microphone. So if everyone can do their best, I think we're getting more in a couple of months to ensure that we don't have to do as much sharing. So my first update is the one that I traditionally give, which is sort of the welcome and goodbyes to whoever's coming or going for a particular meeting. And today we have 2 commissioners that we'd like to recognize. First, we'd like to say thank you to Chief Bob Dunn. Chief Dunn has retired from his position as the chief of police in Fullerton. He served on our commission for almost 2 years and has been a really great partner and ally. He for quite some time was the law enforcement lead of the North Orange County Collaborative. I think I got that name right. And then, one of the many ways he, an example of one of the many ways he's really brought resources and come to the table as a collaborator and a problem solver, I think couldn't be more evident than last winter when he called us up at the county and me up at the county over the holiday weekend and said, "Hey, listen, if you need a cold shelter, we can do something here in Fullerton." And we were able to pop one up within 45 days, and largely due to him and his colleagues at the city of Fullerton with their willingness to just roll with the punches. And then, really appreciated it. It was a smooth 2 months, and just really appreciate Chief Dunn's time here on the commission. Then we're also saying thank you to City Manager Christine Ridge. Her stint here was, short, but she's always been a strong partner with all of us around the table in her role as City Manager of the city of Santa Ana, and we appreciate the time that she did serve here on the commission. All right, my second update is around the cold weather emergency shelter ad hoc. So as many of you may remember, in our June meeting, cold weather shelter ad hoc group was created to discuss what a potential cold weather shelter should look like in the upcoming winter weather season, specifically taking into consideration the feedback from the cities that have previously hosted the cold weather shelter. Excuse me. When the ad hoc met in the summer, it was agreed upon that the cold weather shelter structure, or a cold weather shelter structure that consisted of smaller regional sites that catered or served the proportionate need of the location in which that site was located is really the ideal model compared to one large congregate site that serves the entire county due to the burden that puts on the host city. So in the ad hoc suggested, in the spirit of understanding that any shelters, especially the cold weather shelter, is a partnership between the county, the city, and the provider, the cold weather shelter ad hoc suggested up to the commission that the commission write a letter to each mayor asking them of their interest and what they might be able to provide in terms of a cold weather shelter that's proportionate to their needs in this upcoming season. That letter was reviewed by the ad hoc and by our commission leadership and sent out roughly 2 weeks ago. The letter really stressed, and I've spoken to a handful of commissioners over the last couple of weeks about this particular topic. The letter really stressed that the commission, and specifically the county, because the county is, as you all know, the ones that host the cold weather shelter or administer the cold weather shelter each year, is really open for a discussion. The letter provided several examples that for a city to think about. We've heard some feedback, which is encouraging, and there are a few meetings that are pending to discuss with certain cities about what that might look like. I guess I'd also ask, knowing that this is a group, the commissioners are a group of leaders throughout the community and have, communication and contact with many folks throughout our county. Feel free to communicate that the county is not necessarily only interested in them coming with a final fully baked product. That would be the ideal piece. We absolutely don't expect that. We articulated that in the letter, that we're interested in their thoughts and their ideas and really interested in engaging in a conversation. And we do have the potential funding to help assist. So I'm excited about the handful of meetings that are pending. I think they're an ability to have an open and honest conversation and hopefully come to something that will be able to serve the folks that we need to serve. And with that, that ends my update.
Are you, will you take questions?
Yeah, please.
Um,
Turn the microphone on.
I don't know. All right, thank you very much. We go back to the first one first. We knew Chief Dunn was retiring. He gave us plenty of notice and we started recruitment. It's item 5. And you have a recommendation for the chief of police representative for the 2-year term, correct? However, Ms. Ridge was here for one meeting, and so we didn't have time to anticipate that vacancy, which we know about obviously now. However, there has to be a recruitment for central services now, correct?
We're gonna get to that further down in the agenda. I think it's agenda item 5 or 6. Yeah.
I understand, but you gave that update, and before we get to that, you have a recommendation for 5 positions that don't include central services, right? Okay, how long ago did you start that process to come up with the recommendations for the 5 positions? When did that start?
That started several months ago, and we here last commission meeting approved the opening of that recruitment process in August. So the 5 people that are being brought later in the agenda for their seats were seats we were aware of prior to our August meeting. And there was I think it was a 5-week open window for solicitation and recruitment for those seats, at which time we did not know. My office was meeting.
You know what? I know that part.
Yeah.
About what her plans were.
Mhm.
My only point is, we're doing serious work. We have to plan. These things take time. And now we have a vacancy for a person who stayed for one meeting. And now we have to delay our process and go back where we could have incorporated that, had, you know, at the beginning. I'd just say in the future, if we're gonna ask somebody to be on this commission, they should have to indicate with certainty that they're here for the duration of the term. Because otherwise it's wasting all of our time. And this is, these are some of the busiest people I know in the county. I'll end on that point. My other point is on the cold weather shelter. And I really defer to the supervisors, having been one, that I don't like to stick my nose in your business about how you communicate with your cities. My point was going to be this. Do we as a commission have some responsibility or an opportunity, and let me phrase it that way, to go to some of the council meetings and talk about opportunities for, like, in other words, take a leadership role for this commission and show up and talk at their council meetings and let them know that there's an interest here and we're ready, willing, and able to assist. Now, there's again, to the chair and Supervisor Sarmiento, I don't want to step on anybody's toes because you have your own dynamics you're dealing with your cities and sensitivities, and I don't want to put anybody in harm's way. I'm just asking with respect to that, since the letter has gone out, should there be some follow-up from us?
Anyone have an answer or want to weigh in?
Well, I would like the elected officials, so I really have to defer to you all.
Right, you're deferring to us. Let me see what other commissioners have to say on that point. This is a fine point. Commissioner Wyatt. Go ahead. Paul, yours. Go ahead. Yeah.
I've on both topics. So in terms of the open position now, when we were recruiting for that position, there was a recruitment process when Christine Ridge was selected. And since it was such a short time, were there other candidates that we might go back and revisit that as an opportunity to not have to go through that whole process again, but look at the other candidates who applied and didn't get selected?
So yes and no. We are able to take applications from a recruitment process that was so recent and apply them to the pending open recruitment that's coming. Well, regardless, we'll have hopefully a nomination by next meeting. So whether we open that window or go with a batch, so I think it's best that we open the window, communicate with those that previously apply, see if their interest is still there, and then take new candidates, and then ensure that we have a recommendation to you all by our next meeting in December.
So on the cold weather shelter, so I think, I think in terms of getting the 34 city managers to step up, it's kind of like in the army and asking somebody to step forward to volunteer, and you don't get a lot of people stepping forward unless there's a push there sometimes. So I agree that if we don't take a leadership position somewhere and pull a few cities together to do something where we're not committing to anyone, because once they step forward, they're committed, whether they're really prepared to do that or not. So they'll all hesitate. And we don't have time for between now and what it would take to implement in cold weather to wait long for that. I think, for example, I think in South County, I've had several discussions. I think there's an opportunity for us to potentially look at some of the hotels that are underutilized in the winter from November through March. Those hotels, I think there's opportunity where we can do a non-carbon shelter for the veteran in South County for a number of reasons that we could go on. But unless we pull a few people together and have a really in-depth discussion and make some moves on that, look at how it would get funded and what the cost per person sheltered is versus operating another one, we won't get there. We may not get there, but we certainly won't get there. We're going to have to step forward.
For myself personally, I spoke on the cold weather shelter subject last night to my mayor, John Stevens, and to the staff member, Nate Robbins. We passed the letter off too, and they have responded. So I would suggest that other members get in contact with your city that you live in and push the city to accommodate a cold weather shelter. Thank you.
Yes, thank you, Chair. So on both items, I think that on the first one, we were all kind of encouraged and looking forward to having City Manager Ridge join us for longer than she was able to. I think it was, down lost. I think it's fair to ask somebody when they come on the board just to see what their future plans are. I think sometimes decisions and other intervening acts happen, and that's all I want to say on that. But I think that voice will certainly be missed. To the extent that on the cold weather shelter, I don't know. I don't think this approach has ever been tried in the past, but I do think I agree both with Director Wyatt and with Spitzer that there should be some follow-up in addition to the letter. I think what we had thought was if there is some initial response just to the written request, right, that would be great to encourage cities to come forward. To the extent there aren't, there may need to be some, rather than forcing anybody, encouraging, right, and encouraging them in a way that there's options, whether it is vouchers to the hotel, whether it is just sparing a few beds in your navigation centers or shelters that you have in your city, and kind of cobbling together amongst now a network of shelters that we have to see how everybody can kind of all lean into this. But I think that's the way we had discussed in the ad hoc, that it would be sort of steps, but I do agree the timeliness of it is upon us. So it has to be done now fairly rapidly, where maybe all of us as ambassadors of this commission and members of this commission go out and maybe speak with our partners that we have and say, can we all find a way that makes sense in our different cities and our different regions, how we can, help out and provide at least some membership, some support, even in a small way. But that's something that I'm hoping could be next steps on that. And I think all of us hope we can lean in.
Anyone else? All right, let me agree. Next steps would be maybe a little bit further communication and a little bit perhaps more aggressive. It does seem as though it is South County that really ought to step up in this. I've got a portion of South County, but most of it is in District 5. I have had conversations with the District 5 supervisor, and I know she shares the concerns that you've raised, Commissioner Spitzer. So I pledge those next steps in my district and with hopefully all of my colleagues, our colleagues, those next steps, but it would not be inappropriate, I don't believe, for this commission to weigh in and to the extent you have contacts in any of those cities, ask, what are you doing? Who are you partnering with? Maybe you don't want to do it alone. That's fair. Who are you partnering with in your region to make sure we get this done and get it done timely? So I will agree with those. Follow up, Director Spitzer.
Is it possible, so is it possible to ask staff to pick any cities who maybe have given a response? I don't want to board them off because suddenly we just parachute in. But if you could look at what areas you think might be open, look at what council meetings they have and give us those dates, and then basically just break us up and just tell me, hey, Todd, be at San Clemente City Council on this date or these 2 dates. And we'll just try to figure it out. In other words, I would just, if we could just help get it a little bit organized so that we know who, we have like a team, and then we could go to that council.
You are not wrong, although you know the complications as well as certainly as we do. I think everybody on this commission knows this. Like, I mean, you pick San Clemente. San Clemente's got an answer. They sent a letter saying, put them all at Fairview.
Maybe I shouldn't have picked. City.
So maybe you shouldn't.
I just picked the city.
But therein lies the problem. You want to be careful. If somebody responds, oh, I'm receptive, you then say, okay, you're it. The next time you ask, they're not going to be. So it takes a much more nuanced and coordinated approach, as you recognize, and you're asking, you're saying you don't want to step on anyone's toes. I pledge in my district. I hear Supervisor Sarmiento say the same thing. I do not speak for Supervisor Foley, but I know of her interest that we will be working towards getting those coordinated response.
And maybe what I would also offer is for any of the other commissioners, we're incredibly grateful for the time that you spend with us here. We know it's done on a volunteer basis. So asking you to do more, we know, especially, with, again, schedules we all keep, any time would be helpful, but maybe that's something that you can share with Doug and say, look, I'm available to meet with some folks, relationships in my city, and that might be a way for us to kind of see who's available.
If I can pull 3 or 4 cities together, who would I meet with here? Who could I bring from the county to meet with them?
From the county? Well, I would start by saying it might depend on which districts those cities are in. If it's my district, I am with you, locked arm in arm to have those conversations. If it's Supervisor Foley's, again, I can't speak for her, but I do believe there would be, as we talk South County, there would be a receptivity there as well.
So we should work through the supervisor's
Well,
office.
yes,
That's fine.
I would, as this commission ultimately reports to the supervisors, I think that's the logical place to go. Unless anybody has any other better ideas.
I would just tack on a staff that supports the supervisors. If you could just CC me, and I'm always here for support and assistance. Yep, thank you.
That's sure.
Let me go out on a limb. Every city has one or more public libraries. Would there be a way to ask every city to, on a special event like a cold day, open the public libraries to the public for purposes of warming? Just throwing that out. Then everybody who has a library, which I think is everybody, would be in.
Out of the box thinking, I
Going
think
out,
it's
going out on a limb.
it's something worth doing. I'll throw the complication out there. A lot of them are under the county library system,
Okay.
which would be a clearinghouse to maybe get some of it done, but then some cities are out of the library system, would perhaps take a different approach, but those are facilities available. Maybe that's the answer. You have to look at the costs. You're going to have to staff them through the evening. But that's the great kind of thinking we want to encourage here. All right. Anything else on this one? I am told, and I apologize for being late, I am told we are at item 2. Madam Clerk, if you would read the next item.
Item 2 is a presentation titled 2023 Homeland Survey presented by Doug Beck. We have no requests from the public to speak on this item.
All right, let's go to Mr. Beck.
Yeah, I'm gonna take a. All right, good afternoon, everyone, again. So we're excited. Today, we've talked for a whole host of months, thank you, about this survey. It's been a year in the making, arguably, and we're really excited to share the data today. We're getting ahead of ourselves. I guess I'll lay a little groundwork before I get going. I'm going to go through the slide deck. When I get done with reviewing the data, I'll ask this. As I go through the data, if folks can reserve their questions about the data until I get to the end of the data, I'll take a pause and then we could answer any questions about particular data points. When we're done with those questions, we'll move on to the findings and the recommendations. So that's how I'm hoping it goes. So diving right into it, I first want to really thank a whole host of people. This was a really big lift to move forward. I think, I'm sure I'm going to forget a couple of groups, but CityNet, our project lead, who did the lion's share of work that went out in the month of May to collect the surveys, helped collect the data, set this as a priority and really displayed, their expertise in this area, and we're really appreciative of them. Our PIO office really helped with organizing today's slide deck and really thinking about best ways to present it. And then most or equally important is the survey ad hoc group that many of the commissioners either served on or had subject matter experts from their staff serve on it. And I really want to thank those folks, and I'm excited to hear from them as we get to the findings and the recommendations. As a reminder, as a reminder of how we got here. So when I gave a presentation roughly a year ago about the 2022 point in time count, I appreciated the commission asking, hey, should we be doing this every year? This is really important information. Other communities do it on an annual basis, and they asked us to report back. And what our office did was we went back, we spoke to our staff, another group who needs to be thanked is Hub for Urban Initiative, who's really the consulting experts on everything COC, including point in time count. And we realized it's just too heavy of a lift. It's a full community, a full village lift to do a point in time count. But let's use it as an opportunity to ask the questions that we don't normally get to ask on the point in time count and fill those gaps. And then as we went back and we worked with the ad hoc group to think about the questions, we really zeroed in on two areas. We zeroed in first on the unsheltered population. As we've discussed with the point in time count and other areas, what we're seeing through the point in time count is a trend that chronic homelessness is going up, length of homelessness is going up, the severity of disability of those that are still on the street are going up. So the population is changing. And I think as we're 7, 8, 9 years into building a system of care here at the county, we've done a really good job of getting a significant amount of people indoors and ending their homelessness. I think we see that through the results of the 2022 point in time count. So going out to them and asking really two sets of questions is critical. A, you've been out there for a while. That probably means you've engaged in our system. And when I say our system, and as I go through this deck here, our system means not just the County of Orange, but our system is a large community. The services and shelters cities provide, our nonprofit community. It's really a large we here. You've probably engaged in our system before, but yet you're still out here. Help us know what that reason is so we can better improve our system, because our goal is to address and help you end your homelessness. And the best way to, one of the best ways to do that is to hear from you. How do we best shape our system? So we're going to go through some data on that. And then the other part was each point in time count, we asked folks about their ties to the county. And as we know, roughly 75% of the people report that their last address is here in Orange County prior to becoming homeless. But we don't ask about their community or their city, knowing that, here we break down Orange County at the county level when it comes to services by SPA, service planning area, north, central, south. And then cities play such an incredible role in this process as well. So digging a little deeper in that. And we have a lot of really good information here. So the slide deck, the extended slide deck is on our website. The commissioners have the extended slide decks in front of them. What I'm going to present is a condensed slide deck in the spirit of time that covers everything, but you get a little bit more information here with the extended slide deck. So first, I wanted to just recognize that and inform folks. So we were shooting for, if you all remember, 20% of the unsheltered population according to the 2022 point time count. So I think that number was 612 we were looking for, unsheltered folks. And during the month of May, Matt Bates and his team from CityNet went out and surveyed and collected 642 surveys throughout Orange County. One thing worth noting that's incredibly important is that we divided up the county and we used the 2022 point in time count city breakdown to ensure that we were getting 20% of each city's count. So we believe that there's a fair representation of those who are experiencing homelessness throughout Orange County in every city. Matt and his team were able to achieve that mark in every single city, and we really appreciate that. So we ended up getting 642 surveys. Worth noting is that 642 surveys resulted out of 842 engagements. So about 77% of the engagements that Matt and his team had with people resulted in a completed survey. And CityNet, as they've reported, has done dozens and dozens of different surveys and point in time counts, and the mark's usually about 70%. So people were responding to this survey at a greater extent than other surveys or resources. And you'll see that's sort of a trend we're going to see throughout this data. Quick reminder was we built the survey understanding that although the surveyors, all CityNet employees, were going to go out during the month of May to known locations of where people experiencing unsheltered homelessness usually are to conduct those surveys. Even as we get through the surveys, some of them are going to say, hey, listen, I actually stayed in a shelter last night, or I actually have a house. I stayed in someone's house. So we wanted to collect data on those people as well, even if we realized, okay, it's not the exact target population. So 31 people said that they had a home, that they slept in the night before. Almost all of them ended up stating that they were at risk of losing that home. 25 people said they were slept in a shelter the night before, and 586 people said that they had slept in an unsheltered location the previous night. Real quickly, I know when we created this, we had a big discussion both here in this room and at the board level. How long is the survey? Because it's important that it's not too long and people don't get survey fatigue. When we field tested it prior to May, it was about 30 minutes to get through. Most folks had about 59 questions. As Matt's team got better and better, or not better and better, but more used to the survey, giving the survey, it actually was an average of 17 minutes to conduct the survey. You'll see in the packet, there's significant information about demographic breakdown. We collected a whole host of information. I'm not going to go through that here, but what's really remarkable in gender, race, ethnicity, sexual orientation, we saw almost very comparative levels to what we saw at the point in time count. So we believe that this group represents the larger population in many different ways: geography, gender, race, ethnicity. The one group that was under that one could argue was underrepresented in this is folks below 18, TAY or youth. So here's where we dive into our data here. So the first question, or the first question we'll cover here is length of homelessness. And as you can see here, the question was around, did you become homeless for the first time in the last 12 months? And only a little over 18% said yes. Obviously meaning the inverse, almost 82% said that they've been experiencing homelessness for over a year. As we dug into that 81.5% and asked them further, okay, if it's over a year, how much longer over a year? It was really interesting to see that it was, 18% of all the folks surveyed said 1 to 2 years, but then you're up to 30%. So 60% of the people, if you combine 3 to 5 and 6 to 10, 60% of the people reported that their homelessness has been for 3 to 10 years. And then, roughly 12% said over 15 years. So this is, I'll say this is a self-report piece. We think it's accurate. We validate, we believe what people are telling us. Obviously, when asking that question, people can, they consider their experiences slightly different. So one might point out, at times people can second guess that. I think the takeaway here is really important is that the numbers are alarming. So even if we're off by 5 or 10% in any of these categories, we still have folks with long periods of homelessness, in our community, long period, and specifically on shelter homelessness. Then we asked, where did people sleep last night? Now, this was obviously the question that helped us guide folks into those one of three tracks. But also worth noting here is that 70% of folks said they slept outdoors, and then another 17.5% said they slept in a vehicle. So, I think the vehicle percentage is an interesting one. I think it's a significant percentage of folks, but it's not an overwhelming number, an overwhelming percentage where we might want to completely bend our priorities or approaches to folks in vehicles. But it is significant enough to know that we still need to be doing our due diligence in reaching out to those folks. We asked, we drilled down a little bit, and we want to share that here. We asked folks that answered if they were sleeping outdoors, what did that look like? And 76, 3 out of 4 people, more than 3 out of 4 people said that they were sleeping with only a blanket or a sleeping bag. And that usually means that they're sleeping alone or with 1 or 2 people. And then as you go to the other side of the slide, I know that we asked about tents and tent-like structure, but then we really drilled into the encampment, which we used the USICH definition, which is a place where multiple people stay for a continuous time with built structures and personal belongings. Yes, we did help folks when we surveyed to define them so they knew what they were answering. And only a little less than 16% of folks said that they were living in an encampment. Obviously, that number would look significantly different if we did this survey 5, 6, 7 years ago when we had the riverbed and the Civic Center. I think it's a testament to the work that's been done in our community from a policy lens and a funding lens. We know that the governor is and has dedicated significant funding to address specific encampments in communities. So communities need to apply per encampment for significant funding. It's been over $500 million made available for that. We've accessed a decent amount of that funding here at the county, but for a community that doesn't have as large of an encampment population as other communities, this is an area where we want to make sure that we're still receiving the funding that we need to address the problems here in Orange County, not be penalized for the good work that we've done. Then we asked folks of those that stated that they were in a vehicle, and roughly 87% of those folks said that they were in a car, van, truck, or camper. And then the balance of those folks, 14, essentially said they were in an RV without access to sewer or water. So I could go a little bit more into the technical details of those answers, but ultimately the way I view it in a simple way is most of the individuals reported being in a functioning working vehicle compared to, for lack of a better word, a dilapidated vehicle that was in disrepair. So I'm going to take a transition over to our outreach section. So we asked all individuals that stated they were experiencing unsheltered homelessness about their contact with outreach and case management in the last 3 months. And as you see here in this slide, less than half of the folks reported that they had engaged with an outreach worker or a case manager in the last 3 months. Now, this survey builds upon our point in time count, the UC San Francisco survey, a survey done in the former District 2 a couple of years ago that asked very similar questions. And this outreach question is the first time we've asked it like this, and we don't have a particular benchmark that says, yeah, 47.8% means we are the best, or 47.8% means we're the worst, or somewhere in between. With that being said, what it does mean is that there's over 50% of the people that we have not engaged in our community in the last 3 months. And we have, whether we're first or last, we have plenty of room for improvement in that area. As we asked the individuals who did engage within outreach or case management in the last 3 months, what did that engagement look like? Were you able to successfully get linked to some type of service? This slide here shows obviously the 51.5 who hadn't engaged. The lighter yellow is a quarter of the people who said I had engaged with outreach in the last 3 months, but I wasn't connected to services. And then lastly, 1 out of 5 folks said I engaged with outreach or case management in the last 3 months, and they connected me to a resource. So then I asked folks, okay, what would be a valuable, what are you looking for? What would be helpful for outreach or case management while you're on the streets? What are you looking for them to offer you? What is most important? And we have an interesting list up here. So folks could answer more than one, and they did answer more than one. The top remark here, as you see on the slide, is more than 4 out of 5 people, said they were interested in hygiene services. So that includes anything from hygiene products to access to a bathroom. It's a fairly wide bucket, but it speaks to the here and now. Then almost all of them, or close to that same percentage, said they're interested in housing search assistance. And then, the third answer was storage of personal belongings, and then financial assistance for rental deposit or housing. And I won't continue the list. Why we colored these selections was because we really wanted to point out when we reviewed the responses, we saw a trend here. In blue, obviously speaks to folks' immediate needs, hygiene, storage of belongings. And then in green is long-term goals that have long-term impacts. And then orange is, you could argue, fits both of those categories. And I think what this said to us, or at least to me, is really interesting. People are interested in getting help and becoming, getting housing and ending their homelessness. But they also need immediate things to get through each and every day. And when you sit back and think about that, that's fairly obvious. Something I, it surprised to me, sort of disappointed. It was a surprise to me, but really, obvious that, people are in immediate crisis and they need help in that immediate crisis. The other thing it says is that like any human being or most human beings, we could be interested in two different things at one time. So we can focus on our immediate needs and we could work on our long-term needs at the same time. And we're sophisticated enough to ask for help in both of those, which I think is, a reminder and also encouraging. Now, so this slide here. So we took, what you're looking at here is on the left, the desired services. That's the table that was on the last slide, the things that people said they wanted. And then on the right are the things that the folks that did engage with outreach said that they discussed with outreach in the last 3 months. And what's interesting to some degree is that, and not totally surprising, that the first two things that were the most popular things that were discussed was a focus around housing. And I think that should always be the case. Our goal, the only thing that ends someone's homelessness is getting them a home. And, our contracts, at least here at the county and at a lot of cities, are focused and tell our providers you really need to hone in on that. But what was also interesting was that hygiene was so low. It was the fifth answer, but it was the first thing they wanted. And I think this is a reminder as someone who has a career in doing outreach, when you do outreach, you're essentially going out to, and I'm use sort of you're going out to your client, your consumer, and you're doing a cold call to them. They're not coming to you. You're going into their space and you're asking them to engage you and to agree for you to be a part of their life and for you to help them. And it's always really important that when you start that process and build that trust, that you're listening to what they're saying. So I don't know what the perfect balance for this would be, but it's a reminder for those of us that are doing outreach, whether it's through outreach teams, law enforcement, mobile teams, that we have to, constantly remember we've got to listen to what the individual is telling us. That doesn't mean we need to do everything that, that they're asking or requiring, but like in any relationship, you want to make sure that the person you're engaging with hears you and respects you. So we thought that showed itself in an interesting way with this slide. As we transition to asking folks about, okay, have you ever been in a shelter before? And this is where I want to make another strong reminder, which is that when we ask these questions, including the outreach questions, we didn't say, have you engaged with Anaheim's CityNet team? Have you engaged with the county's outreach and engagement teams? We just said outreach. And then when we asked about shelter history, we just said shelter. So folks can be reporting on their experience in the county shelters, in the cold weather shelters, private shelters, and city shelters. So that isn't said to immediately pass the buck and say, yeah, they're talking about someone else. But it's just to lay some groundwork so people understand that this isn't an indictment on one particular group or the other, but that we can all be really looking and using this to look back at our own systems. So 47% of the folks said that they had been in a shelter previously and throughout the county. Then, as I go forward, we asked folks basically the same question in 3 different ways. And I've got a really fantastic transition in slides here that blow you away, and we'll get to that. Here, one. All right, so we asked folks about the top reason for leaving shelter, for those that were in shelter. And not that the top answer had a strong percentage, but the top answers were, and all of these questions, individuals can answer more than one answer. 17% of the people said the rules will be being too difficult to follow, concerns around feeling unsafe, concerns regarding staff at the shelter, and concerns around privacy. So this is really, as we go through these next two questions, you're going to see the obvious theme. So then we asked folks, okay, what's the top reason you're not currently utilizing a shelter? And we heard the first one, lack of available spots in the shelter. That's something, 1 in every 4 people said that. And that's something I think we could fairly expect, even though we've grown our shelter system tremendously in the last year. And when I say we, I mean the County of Orange, but all of our partners as well. Then we see, all right, the second one is concern about feeling unsafe. The fourth one is privacy concerns. The fifth one is shelter program rules and policies are too difficult to follow. Then lastly, we asked it the question again a different way. And we said, well, what do you consider when you go in, when thinking about going into shelter? And we hear the same thing again and again and again. Safety and a safe environment, shelter operators, respectful, empathetic, helpful, amount of personal and private space at the shelter, and general program rules and policies. So what I didn't say here was the other concerns were about their ability to get out of the shelter into permanent housing. So the 25 folks we surveyed that were in shelter, part of their questions were, and it's a small sample size, so that's why we don't necessarily show it here, but I think it's worth noting on this point. I think it was 84% of those folks, when asked, where do you believe you will be exiting shelter to? What's your next step when you leave the shelter? Over 80% of the folks said permanent housing. So as I hear that small group say that, who are in the shelter, and then as we hear what these folks say here about going into shelter, it says two things that make a lot of sense. People, when they think about shelter and going into it and what it's useful for, they see that there's a value in speeding up their time out of homelessness, and that it's effective in hopefully ending someone's homelessness, a good stepping stone. But when thinking about that physical move into shelter, it's all about safety, respect, and privacy. And, you know, if you take a step back, you go into any physical space, whether it's this room, your home, friend's house, is a stranger's house that's invited you over, you know, that's a basic human interest, that you're treated with respect, you have a little bit of privacy and dignity, you know, and that you feel heard and safe. So, you know, really interesting to hear this, and we'll talk a little bit more about this in the findings and recommendations. I'm going to shift over into talking about disabling conditions. So there's a couple of reasons we talk about disabling conditions here. First, as almost everybody knows, when HUD is defining chronic homelessness, which is really a threshold, and there's so many of HUD's resources. Chronic homelessness to HUD means that you have two things. One, a significant length of homelessness or several episodes of homelessness. But the second one is that you have a disabling condition. So we wanted to measure this to see A, who fit under HUD's definition of chronic homelessness. And then B, more importantly, we continue to see in our point in time count and in other data and research that folks, you know, the population is changing, the population is more vulnerable and things to that nature. So we asked 7 different questions, or we asked folks about 7 different disabling conditions. And what was alarming was that 86% of the people said they had at least one of those disabling conditions. Then 69% of the people said they had 2. And as you can see here, almost half said they had 3 disabling conditions or more. So the folks that are out there are, you know, it's not just homelessness, it's, you know, health, mental health, substance use. There's significant challenges they're dealing with out on the street. That's, you know, incredibly important to note. We looked at the data to see if the amount of disabling conditions people reported increased based on their length of homelessness. And we looked at it a whole bunch of ways, and we didn't see anything that showed that the longer someone reported their homelessness, the more disabling conditions they were likely to report. I think what's worth noting is that, okay, that's interesting, but we all know that the longer you are experiencing unsheltered homelessness, the longer your very challenged ability at best to address your disabling conditions is compromised. And now when you're unable to address those disabling conditions play a much more significant role in your life. We wanted to break down, so just briefly on chronic homelessness to touch on that. We looked at length of homelessness. We saw that over 80% of the folks said that they were homeless for longer than a year. And then we just finished the other piece of the pie on HUD chronic homelessness around disabling conditions. So as we crunched the data and looked at each person, what resulted in is that 69% of the individuals we surveyed fit under HUD's definition of chronic homelessness. This is in comparison to 55% that fit under that criteria during the point in time count just 1 year ago. So, you know, obviously the survey was asked in a much different way by professional staff, but yet again, 14% increase. We believe that the data, especially in this section, is probably more accurate in its self-reporting due to the surveyors, the length of time, the relationship, things to that nature. And it feels like for those of us that are out there in the field, feels like this is more reflective than what we saw in the point in time count. We'll look quickly at the disabling conditions, specifically mental health. 60% of folks identified having a mental illness that was ongoing and prevented their ability to live independently. Prevented word is the one I'm stuck on, but 60% compared to 30 in the point in time. So this is a stark difference in percentages. It is, you know, there's a whole, there are a variety of reasons that might be. Both, we asked 2 questions here compared to 1 question in the point in time count. I mentioned the professional, non-professional component of it. We targeted individuals that were experiencing unsheltered homelessness and really had an emphasis on engaging folks that we believe may have been out for a minute. But nonetheless, doubling that number, all of those reasons I just mentioned, I don't think absorb the reason why it doubled. It's significant. Then we asked those folks, or we looked at the data for those folks around the services around mental health treatment, if they were getting services for that mental health treatment. It was really interesting. So 58% of folks said that they were either receiving services for their mental illness or wanted treatment but could not access it. So more than half of the individuals stated that they're either addressing it or want to address it. Now, clearly there's a significant minority, 42%, that either said they didn't need it, didn't want it, didn't know. But I think this is a higher percentage than I think most of us would think. 58% of people saying that they're either getting it or wanting to get it means that, that this group is aware of their mental illness and interested in engaging in improving that. Substance use, we saw 47% with the point in time count was 41%. So 6% increase in the response for this particular disabling condition. Asking the same question about services as we just went over about mental illness in regards to substance use, we see here the number is 49%. So almost half of the people report that they either are receiving services or want to receive services to address their substance use, which I think yet again is a number that's larger than I expected. And yet again, you know, that leaves more than half the folks, a little more than half the folks saying they don't want it or they don't need it. But 1 out of every 2 folks stating interest is, you know, I think something that's worth, you know, continuing to look into. It doesn't say that this group is uninterested. Okay. Lastly, on this topic, we took a look at everyone that we surveyed around their healthcare services. And 64% of the people stated that they were getting and receiving treatment for their healthcare services or wanted treatment but couldn't access it. I think worth noting here is in the other two slides, the yellow bars were fairly about the same height. In this slide, the yellow bar for those that are receiving services is much higher than the small bar that says that I wanted services and couldn't access it. And I believe that's due to the efforts that our healthcare community has made in many different ways and are in understanding that this group of people so sorely need access to primary health care and seeing that need and providing. As we dig a little deeper into healthcare, we asked folks about their health insurance coverage. And as you see here, 85% of the individuals reported that they had health insurance. That's similar to the percentage that was reported in the old D2 survey that was done roughly 2 years ago. And it's dead on to what we heard 2 months ago from Dr. Tiana Moore at the UC San Francisco study, which reported out of the 3,200 people they surveyed throughout the state of California, the number was 85%. It was dead on. 90% of those folks reported having Medi-Cal, 8.5% reported having Medicaid. And then roughly 83% of the individuals who said that they had Medi-Cal reported that Medi-Cal was with Cal. So I think the question is, as we've talked with the ad hoc group and with executive leadership here at the county, one of the things that's interesting about insurance, and it's absolutely fantastic that the number's up to 85%. The next question I think that group says is, okay, how do we increase utilization? Folks have health insurance. Now, how do we make sure a greater percentage of them who have it are engaging in it? Okay, now we transition to the last piece, and I'm getting close to landing this plane. The last section here was that second section I mentioned earlier in the discussion, which was we wanted to understand a greater understanding of people's ties to the county and their community. And I think we got really good data. So this slide right here is looking at it purely from a county standpoint. So this first statistic, 77%, that last address, that corresponds with what we see in the point in time count around asking people if they're from Orange County. It also lines up with the 75% in the UC San Francisco study that I've referenced before. So 3 out of 4 seems to be, this seems to be a valid number. Then we asked folks about 4 other ties to the community. And we asked that because A, we were interested, and B, because cities and the county all ask 1, 2, 3, 4, a variety of these questions when trying to establish who is their homeless individuals. It's a critical data point to understand ties to community. So 97% of the people we surveyed, almost everybody said, most of my time experiencing homelessness, I did so here in Orange County. Then 57% of people said they have family here in the county. 62 said schooling and 80% said employment. I've said this to the ad hoc group and some of those that have been briefed. This is sort of an interesting slide and one that I sometimes challenge with a couple of these criteria, specifically the lowest 2, which is family and schooling. If I did a survey of everybody in this room, if we reached 57% of people saying that they had family outside of their household, in Orange County, I'd be a little surprised. I'd imagine it'd be somewhere around that same number. I would answer no to that question. Schooling, 62%. I'd imagine that number might be even lower if I surveyed the same group. That answer for me would be no as well. So trying to figure out, who, how do we make sure we prioritize our limited resources and dollars to the folks that will have the highest impact and really need them the most. We're still figuring out the best answers for that. And we'll dive a little deeper in coming slides on that as well. So as we asked folks about their ties, we asked them about what's the main reason you stay in the location, area, particular city. And I found this response, yet again, obvious, but surprising, if there's such a thing. Half the people, now this is a question that people can only answer one selection to. Over half the people said they were most familiar with the location in an area. Then another almost 20% said they had a friend and or a family member that lived nearby. And then another 15% said that they felt safe in the location or area. So you add those three up together, you get almost 85% on the dot. And I would argue that all three of these really speak to an individual saying, this is where I feel most comfortable. And the reason why, the 85 is always surprising, like a high percentage is surprising. The reason why it's obvious is I sort of took a step back was, when anyone's in crisis, your first thing isn't, okay, let me go find a new place to go lay down my roots. This is someone, whether it's a higher being or logic telling me it's time to move to where I don't know anyone. Really, whenever we're in crisis, we go to where we're most comfortable because it's such a vulnerable moment. And this really lines up with that. And then we had asked, how did individuals get to this location, area, or particular city where they were serving? And over 85% of the people said they got there on their own. A small percentage said 11%, I guess 12% said that they received transportation from either a friend or a family, half that 12%, or a third party. So yet again, people have gotten there on their own. The last slide says that they spend most of their time, and we'll see in the next slide to even validate this more, they spend most of their time really in one location, and it's a location that they're comfortable with. So we sort of see a trend here that people they go to a spot and they sort of stay, and it's a place they feel comfortable with, not a new destination to, check off the bucket list. So then we broke down the information by the city or physically neighboring area, the spa, county, and outside the county. We broke it down by small, and then we got larger. Essentially, we were able to do that because we asked these folks, what city do they spend most amount of their time experiencing homelessness? What city did they go to school in? Things of that nature. We were able to divvy that up. What we see here is yet again, time spent experiencing homelessness rated highest in any geographic breakdown that you got. 73% of people said that the city you are surveying me in, that's the one that I have spent most of my time homeless. When we opened it up to the city we surveyed them in, plus the physically neighboring cities, that number grew to 90. 9 out of 10 people either stay in the city that they're surveyed in or surrounding one. And especially throughout Orange County, we know that so many of the 34 cities are smaller cities that if I go down the block to the grocery store, I'm now in a new city. So, that neighboring city is, I think, an important data. And then as we go through last address, family ties, schooling, and employment, that number significantly shrinks. And as you would imagine, as I just mentioned, we have small cities. So even if you answered yes about your schooling in Orange County, how many of you are still in the city you went to school in Orange County? I don't live in the city of Santa Ana. So that's another bucket I am now a no in when I answer employment. So, really, this is one of those times where I'm interested in the conversation the larger conversation on this, where essentially I've brought you information and arguably a problem without necessarily bringing a solution forward, but just really pointing out that there's some inconsistencies here. And then my last slide, before I'll open it up to the group, is I think if there's one finding, and I know I'm now talking about findings, which is getting ahead of myself, but if there's one thing that's really, that was debunked here, arguably, is that we went out and we engaged over 600 people, many of them who've been on the street for quite some time, engaged in our services on and off, and over, in so many different ways as we slice it, people showed that they're interested in engaging in the system and they're interested in services. They're interested in improving their well-being. Now, are they interested in doing exactly what we want when we want them to? I don't think anyone's interested in that. But that, I think is a calling to yet again figure out how do we continue to shape our system. How do we continue to shape our system to welcome people in? I'd also say that that's also reflective on our system that we've created. That so many folks say yes because they're aware that we do have a robust system, and that robust system is often very successful in helping people. So it's both a validation of, I think, the work that has been done collectively in the county, and also a call to action that this is a group that wants, to engage in their well-being, engage in the discussion. It debunks arguably the myth that who's ever out there, they just want to be left alone and they're uninterested in help. And, I'm 77% of folks, like I said, completed a survey. 78% of people that completed a survey were willing to give their name and date of birth for further analysis for the study. So yet again, a group that's, sometimes we hear, oh, people are ashamed of experiencing homelessness, or, they don't want to share information. Whether those are true or not, what we see here is that people are willing to give their name and date of birth, and good engagement, which CityNet is professionals are doing, and so many other groups, but for this exercise it was CityNet, results in that. 93% of people either reported that they had an active benefit or were engaging in some type of support. So almost everyone has some type of benefit and or engaging in some type of service. And then, I won't go through some of the repeats here of 58% either wanted or accepted. Mental health treatment, 49 on substance abuse, 64 on primary health care. But the last one that I didn't mention previously is that 38% of people said that they wanted help right now. So if you can connect me after this survey to help. So 38, you might say, oh, that's not really a big number, but so many of them are already getting help and already connected to the system. The 38 is still a significant number of folks saying, hey, if you could connect me here and now, we really appreciate that. So, oh, I'm sorry, I went off. All of what I just said pertain to this slide. And I'm going to assume everyone wants me to just not go over the slide again. So with that being said, thank you, Zelina. This is the end of our data portion. I ask people to reserve their questions about findings and recommendations to our next discussion. But if anyone has questions about the collection of the data, I'm all yours.
Back there, anyone want to start, Commissioners?
Mr. Chairman,
Does that work?
yes. Well, thank you, Doug. I just have to compliment you and the team that put this together. I know we had an ad hoc committee that helped design this. I feel like this is a significant addition to the data sets that we get out of the point in time count that's going to be very valuable. I know I'm going to be relying on it in my upcoming career path. So thank you very much to the whole team that worked on this. One question I had that kind of jumped out at me was the age demographics. I don't know what slide it's on, but the age breakdown. When I look at the older adults in these cohorts, it doesn't seem to line up with what I know, what I think I know. I'd lean on my other former chair colleague here from the Continuum of Care, Marcella. I think that there's a higher preponderance of people over the age of 55 in the coordinated entry system currently that shows up in this data. Am I right? Am I wrong? What's your take on that? We're looking at Zulema.
I got a handful of, yeah, if you want to take a stab at that.
Outreach strategy, right? This was a canvassing effort with hotspot locations where maybe the coordinated intersystem activities are more targeted and really focus on engaging and supporting people through the process.
Yeah, so I just found that to be a interesting data point.
And just for everyone, the commissioners have, like I said, have that full slide deck that includes age breakdown. You can get it on our website. Basically, what the slide that you're not seeing says is it compares the age breakdown of the individual surveyed compared to those in the point in time count, and they're almost spot on in every age category. So there's no other. Oh, please, I'm sorry.
Let me ask you about the apparent disconnect between the desired services and the discussed services. Who initiates the discussion? Is that our outreach team saying, how do I get you into a temporary shelter or find permanent housing? Or not? Because I guess I would ask the question, why are we not first saying, can I get you a toothbrush? And then, hey, let's talk about something further.
So with that specific example, that's very much outreach teams, including our outreach team and the city's outreach teams. Well, I know that our outreach teams bring hygiene packets around and give them out. The other piece of that is sort of access to restrooms and showers and things to address your immediate hygiene. So this is where, like with so many of these data points, it tells us something and we need to dig further. And we need to reflect on, okay, if we bring those hygiene kits out, but yet 85% of people are saying they still need addressing hygiene kits, is that because they're not realizing that we provide those kits or that that's not enough? So, yeah, and then when you think about the other services like mental health, substance use, often outreach is the first to engage, and I think in many ways is the right first team to engage. I also forget about our law enforcement partners who are out there doing outreach day in and day out, both with the sheriff's department and with almost all police departments. So that's critical. And what that tells me is a couple of things. On the outreach side, the HLO side, do I have access to those resources? Am I fully educated about those resources? And then we also have teams out there. BUL has their mobile teams out there. We have CAT and PERT and other groups that go out. And this is where I think a great example of whatever shop you live in, you have something here to look at and say, can we do it better? What is this survey saying about my work? So I know that doesn't 100% answer your question, but.
Which part? Your mic is on.
I didn't touch it, but apparently it wanted me to speak. So I actually was probably going to ask one of the similar questions, but first let me just say this was awesome. So thank you, Doug, for sharing all this great information. And I also want to commend the commissioners that forward this effort forward. So I think that's great that we have more data. I am curious about again, if we cross-reference the people that said, because a lot of people said who they were, did we have the opportunity to go into the system to see if they had actually been connected with services before? I was curious about that. And then the other question I had is just around those 38, and maybe that's talking about something going forward and maybe not about the data, but did we follow up immediately and did they so help?
So we did follow up immediate on the 38% that said they wanted help, and CityNet was fantastic with getting us those names, those locations and things of that nature. We don't have an answer. I don't have an answer right now on how many of those we were able to successfully engage. In terms of going through the names and the data through our system, we haven't had a chance to do that yet. And it's a big lift and it's something we can discuss. Yeah. And in an ideal world, we would have, because it would have been really fast. Supervisor?
Oh,
Yeah, just quickly, I was gonna say the same thing. Look, good work, Doug, on this and your team and CityNet. I know we try to incentivize the responses. How was that? Did that work? Was there like a real need to kind of encourage somebody to, or did they want to offer, or was it really?
That's an important, because it was something we discussed leading up to this as a group and Board of Supervisors specifically at the general meeting. We upped the reimbursement from, I think, either $5 or $10 to $25. I think that had an impact. I also think that just shows a greater level of appreciation. People really, the survey was long enough where I'd argue $25 at some point or another, unfortunately in Orange County or really anywhere, how far does even $25 get you? That someone could have just bailed out if they were interested. So I don't want to ignore the fact that was an increase and that was something that we did. And I'm sure that had an impact. I just think I also think that folks were engaged because we were asking questions that they cared about. That's what CityNet's team had reported. And then, $25 just, I think, respects those people's time, their input a little bit more, not fully, but more than, $5 or $10.
Yeah, I think that it shows that, again, because they've been contacted, they've touched the system or the system has touched them in some way. There's a willingness, but just what's fascinating is the overlays between the other studies that we've seen. So there are some consistent themes that come out of this. I wish we would have asked that question of the cause, right? I think that was one missing link to maybe the other broader studies or the statewide study and the study maybe that was done by United Way. But again, I think we can draw some similarities that really do kind of Venn diagram, really do capture a lot of what we're seeing here. It's consistent.
If people are willing, I'll dive into the findings and the recommendations. I want to make this clear. So I am providing the findings and recommendations. I had a role in them, but really our ad hoc team was the ones who who really led this charge. Many of those members are here, including those that represented a commissioner. The other thing I want to notice is, with many ad hocs and with this group, the staff of this group, we're busy people and we appreciate the time. This ad hoc was increasingly demanding because we met so many times. And I just want to thank folks for that. So 5 key findings that we had. First was people experiencing homelessness wanted help. I really, I'll leave that there. I think I made my point with the last slide that I presented. Second is that chronic homelessness and disabling conditions are on the rise. So like we said, 69% of folks compared to 55 from the point in time count fit to HUD's definition. Double-digit increases in mental health, substance use, physical disabilities.
we go back to the prior. Thank you. Go ahead.
Were noted, and then 85% of the people reported that they had at least one disabling condition. The third is safety, respect, and personal space are most important when considering shelter or transitional housing. As I went through that, those 3 questions there, we saw that people they said, that's what they reported when they thought about going into shelter or leaving shelter. They feel safe. Did they feel respected? Did they have some privacy? Fourth was, as we saw, less than half of the people reported that they engaged in an outreach with an outreach worker or a case manager in the last 3 months. And lastly, people tend to stay in one area that's familiar with them when they're experiencing homelessness. 85% of the people said that they chose their location due to being familiar with the area, having friends or family nearby, or feeling safe. And then 86% of people reported that they got to the location on their own. So these are our 5 findings. And then as we go to our recommendations, they obviously align with these findings. And I'll go through these sort of quickly because I'm most interested in the discussion. The goal of today is these are the findings and recommendations that the ad hoc is bringing to the commission. We want to hear dialogue. If there's some thoughts about adjusting or any of these, that's what we're really interested in sort of landing today. So the first one is evaluate and implement strategic outreach practices to maximize engagement of people experiencing unsheltered homelessness. So that's the finding that less than half of the people engaged in with someone over the last 3 months is significant. And when we think about being more strategic, what I state is, or what I'm suggesting is, should we be looking at our hours, the strategy at which teams go out? Do they go out to the same places each day? Do they have a strategy to make sure they cover all of Orange County or their specific geographic area? Identify roles and responsibilities for stakeholders. We know that in our community, several groups conduct outreach, and the coordination amongst those groups is critical. This board approved, this commission approved in our last meeting to really work with outreach teams and evaluate their responses and their strategies for extreme weather, especially in response to the tropical storm Hillary we had right before our last meeting, and how important it is. So this is on, this is consistent in what we've discussed previously, and I think where strategies can be so helpful in increasing that number from 47%. Ensuring supportive services are low barrier and accessible. So, 95% of people reported accepting or wanting a service, and 85% of them reported that they had healthcare insurance. And yet again, that when I look at the healthcare insurance piece, I know the ownership that our social service agency, that Cal Optima, take on this population. I know the concerted efforts they do to reach out to individuals that fit into this population, and I know how easy they make the application to fill out, and they assist folks. So I think that there's some common themes there that can be utilized and applied through all the many things we do in this area. Shelter should operate under a trauma-informed model, really prioritizing safety, respect, and personal space. So here at the commission, I think we've all committed to, and I've committed to strip as many labels out of the discussion as possible, because they're up for interpretation and definition differently from folks, and they also can be charged at times. The trauma-informed model is for those of us that work in directly in this business, especially in the shelter business, we know that that model really speaks to recognizing people's trauma and ensuring safety, respect, and personal space. And it felt like by not including trauma-informed model, it was just so blaringly obvious that would be a missing piece there. I also want to note that we here at the county and many of the cities operate under the standard of care, a specific document that articulates exactly what it's titled, a standard to which our services should be met. We could have continued investment in permanent supportive housing. We didn't talk about housing here, but for those of you that know the housing funding strategy so well, permanent supportive housing is only one of many different ways and models on addressing and providing permanent housing. But permanent supportive housing is by far the most successful model in serving those with the longest term homelessness and those that need the most support. And our funding strategy is heavily based on the percentage and the amount of people experiencing unsheltered homelessness who have, who fit under that HUD chronic definition. They used the 2022 point in time count to establish that. That was a lower percentage than what we saw here today. So it just reiterates that we need to continue to evaluate that. And then lastly, provide services and resources to the people experiencing homelessness in your community. So less than 38% of people reported that they had family or employment or educational ties in the particular city that they were at. 1/3 of people reported that their last address was in their city. 3 out of 4 people stated that they spent most of the time in the city that we surveyed them in. And as I mentioned before, other data through this survey basically said that, showed us that people go to a place that they're familiar with and they stay there when they're experiencing homelessness. So it's incredibly important that we just serve the folks that are in front of us. With that being said, I'll open it, if the chair is comfortable, I'll open it up to the ad hoc members to contribute.
Good, thanks. I have just 2 areas if you could address. So one is the wanted treatment but could not access mental health, wanted substance abuse but could not access. Those are like, to me, target-rich follow-up environments. And so when you, on your strategy page, does it come under one?
I would argue that it comes under 1. It also comes under 2 as well, providing low barrier access services. So
It just seems crazy to me with as many resources that the board is putting through social services and healthcare agency, all the other people around this table, that people are still saying they want stuff and can't get it. Like, that's unfathomable to me. So what is that all about? What does that mean? Is it that they don't understand it because the system's too difficult to navigate?
yeah, please, Marcel.
I think the need far exceeds the resources, and that's probably not the answer you're wanting to hear, but that's really, I think when you look at many of these things, sometimes access, but what comes to mind for me is outreach workers are great and they give the resources that they have readily available. So if they don't have like a direct contact or relationship with someone on the mental, so someone directly that they can say, here's mental health services or behavioral health, and that creates a barrier. The other thing to keep in mind is that people's needs shift from day to day. And so it could be that on the day that they were first contacted, they didn't need what they were being offered, but they needed something else. And an outreach worker may not have been able to look at that. That's just sort of from my experience. I think sometimes it's day to day, you're looking at what's the most prominent need in that for that individual, especially because they're living on the streets.
Systems, oh, please, Dr. Fabio.
I'll add that, the services that we have readily available and are accessible are either crisis oriented or are severe mental illness or severe substance use complications. Most of these people are not severe and most of these people are not in crisis, but yet they have a need. So while we have tremendous resources, most of this population needs something a bit different than either crisis or severe mental illness therapies as well as treatment. Hope that makes sense.
It makes total sense, but I don't understand why we have that gap.
Yes. And I would just say a lot of us who are working in the mental health side of it are trying to fill that gap. That's the primary focus, is filling that gap, especially as it relates to the homeless problem. So
It's the color of money, and I don't know the answer. So, but different money, right? You can use certain tranches of money, different color of money for certain things. I think around this commission, we have differences of opinion about supportive housing versus, like I've expressed it. I think we should be spending more time on mental and substance abuse, investing there before people can actually engage in dealing with home ownership or housing. Okay, whatever. I'm not here to debate that today. But is some of this money transferable? Does the Board of Soups have options to reallocate money if it's so desired, to that group that we could certainly follow. We have a lot of names now that need those kinds of services that apparently aren't getting them. I'm assuming they're not, but I don't know if that's true either.
The focus, even since Prop 63, the focus has been primarily on crisis and severe mental illness. And we're not making a connection between the continuum of mental health needs and and homelessness, excuse me. That is now improved. We're making that connection. Sorry for this.
I didn't mean to choke you out.
Yeah, it's very,
Add on to two things about that. I think, and Dr. Veronica Kelly isn't here, so she's our resident expert. But we do know that there's a ballot measure for changing the Mental Health Services Act funding in the way it's priority. Governor states that there'll be a priority towards homelessness and justice involved folks. So that's one area, and whether we get to that goal or not, or whether it achieves that goal or not. From an operations standpoint, thinking about what I could look at in the mirror and what do I do with this is, I think my first question, if I'm operating one of these programs is am I at 100% capacity all the time? If I'm at 100% capacity all the time, then it's a capacity issue. If I have open beds or open slots, then I'd argue it's probably how are we outreaching? How are we educating people? So that, thinking about sort of, concrete steps, that's where I go with it.
So this was really helpful and I served on the ad hoc, so it was helpful to go through the data. One of the things I think from my perspective, just to sort of name an action item is as we represent the COC is to be able to take this back to the COC and look at where we can continue to improve our own processes as we look at prioritizing projects and also looking at how we're so when we put RFPs out, to what extent are we aligning the RFP language to what we're finding in terms of a recommendation? But I think this is really useful, and I'd love to take it back to the COC and talk to them a little bit more in depth about how we sort of augment the data that we have to make some improvements on our process as well.
Couple of things. I probably have a comment on a number of users working through an ad hoc committee or lots of meetings on them, but just a couple of things I pointed out there. I think the outreach, lack of outreach is an important message. I mean, I would have been disappointed if 90% of them hadn't been touched by outreach in the last 3 months, as opposed to 50%. So that means we're not very methodical in terms of, I mean, if this survey crew could go out and find these 642 and get them to survey and talk to, another 200, then they're not invisible, they're not impossible to find. So if our outreach workers haven't been outreaching, then we're just not very methodical. If I were running a sales team and my sales force hadn't touched half of my customer base in 3 months, I would say I need a better sales manager somewhere. So we got work to do in that area. I guess that I'd like to comment just in the briefness, leave it there. I think the last number 5 on here is really important. I think one of the other things that this group here may be able to address, we've successfully managed to build walls around our cities and on our spa lines and around the various areas and decide who gets in and who gets out as we divvy up, instead of looking at this as a county-wide issue of homelessness that needs to be solved county-wide. We continue to find ways to push it to some other part of the city, some other part of the county, some other group. And that's just not productive in any way. It's basically the movement between them is great. They're here. I mean, even the 23% who said they have no ties to Orange County before they became homeless, we're not just going to carry them to the county and move them out. We're going to have to, the fact that they're here, we have to have some way to address them. So as we've worked through the problems, we've built bigger and bigger barriers and sort of knocking down barriers. And if this group doesn't find a way to pull it back to the county level and address it at the county level and knock those barriers down, we'll just never be successful at really addressing homelessness. in the county as efficiently and as effective as we need to. And I think that was a really important part that came out in the survey. So I'll leave it at those 2 points.
Yeah, again, I think it's lots of really great data. I think that we all wanted this survey to happen, so how we use it, so I'll piggyback off of Commissioner Rios Faust and say that for Unite End Homelessness, we'd love for you to, I think you're gonna join us, you and Matt, for a community chat, so we can start getting this message out. Love for you to talk to the service provider network that we have and share this information, as well as any other ways that we can help get more visibility to how all of these studies intersect. And there's such a good body of work. But the other thing I was curious about is there an opportunity for us as the commission to bring together all these wonderful people who do outreach and do some special training and special day and thank them for what they're doing, and maybe try to get some common goals, because maybe everybody's in their own organization, their own city, and I don't know if that's a good idea or not, but maybe it's been done. It seems to me that as a community to come together and say this work is so important, how can we help you, and arm them in whatever way possible. I'd be interested in that.
I think there's a mechanism to do that. I know Christina Weckley Ramirez, who is oversees our outreach and engagement team. She has the committee that meets through the COC that invites our any outreach provider in. But I think that's a really good point. How do we leverage that? Because the findings are so poignant to that group. And yeah, how can we get that group together to understand where they see challenges and where they see areas to improve?
And know how, help them know how much we care about what they do, because I think it's such a hard job. And if there's ways for us to, again, show that appreciation and help them in any way, I think that would be great. So thank you.
Commissioner Ringwald, your hand, no?
Yeah, this is a
Cornwall,
great,
excuse me.
great report. So thank you for all the time and sharing today. Is there an opportunity for you to present this also to CalOptimum, particularly with the CalAIM program, given the number of people who have health insurance and most are Medi-Cal?
Yeah, absolutely. Absolutely. And we work so closely together. And as we know, we will be bringing a Medi-Cal managed care plan seat onto this commission because we know how important they are. And yet again, I don't want to sound like a broken record, but I think one of the advantages or benefits of this study is that it's not narrow to just one group's work. It speaks to, a large quote unquote system of care for people experiencing homelessness, and so many people are involved in that. And this talks about some of that. So yeah, I'm open to that. Absolutely. I think I'm excited for that opportunity.
Thank you, Chair. So thank you, Commissioner Cornwall, for mentioning that about CalOptimum. And I know you'll be back forward sometime in the future, but just to talk about number 3, I think when we talk about capacity and we talk about whether or not people are actually accepting placement, accepting support and help, to the extent that we saw very clearly the slides that you shown. Things can be adjusted, so I think the conditions are better and people feel more comfortable providing or be willing to participate and accept placement. I think what's difficult is sometimes the model has evolved or should evolve over time. I think warehousing folks with very little privacy, very little respect makes it very difficult for people to say, sure, I want in. I think there's resistance there for good reason. And I think that dignity of a person, having to ask for help and then being treated like you're sort of being just being confined is difficult. I think that just makes it very tough. And then to item number 5, when it comes to, realizing these are people that are local, for whatever reason, the nexus to the community that they're in may be strong, maybe a little bit less strong. Maybe people are from there originally, somebody moved there, somebody had a job there. But there is a relationship now as opposed to that myth, I think that we can now dispel, which means that they were kind of parachuted in from someplace else. That's really not the case. I think it took us a while to get to this point, but enough surveys, enough discussion, I think really does demonstrate that. And I think, again, to those, maybe cities or those areas that felt that way initially, there is now a network of shelters and navigation centers that we can say, look, let's absorb those folks in our area. We shouldn't be resistant to that. I think that this will help. More discussion on this will help sort of break that down. And even talking about our extreme weather shelters, that will help hopefully open up that conversation where we realize these are neighbors, these are people in our community, and these aren't people that are sort of external from our cities. And it does hopefully create some openness, some willingness to just provide more space.
Yeah, I think I'll share a discussion with Commissioner Cornwell a couple of months ago, and she's talking about her work. But and she's describing how the people that are coming into her hospital for care, and talking about, okay, how are we going to address homelessness? There's places outside of the community, and the people she's engaging are saying, hey, my appointments are here. This is where I go to get my health care. I need to be close because I'm tied to this, to this area based on addressing my healthcare. And that can fit so many different things. And I, at least for me, sort of a reminder of, value of it. We recently offered someone a placement probably about 15 miles away from where they were located. And it was a private room, and it was a transitional private room. They didn't accept because it was 15 miles away from where they are, and the way transportation is here in Orange County, it's 15 miles is a journey. Yeah, I appreciate that.
So I just have thank you so much for doing this. I know it was a lot of work. It's a wonderful, wonderful work. So I find the data incredibly helpful. So I just have a few questions. When you look at the folks that are ready and immediately seeking shelter now, right, whether it's permanent supportive housing or shelter, that's right. Are we looking at comparing what number of vouchers are available, who's on the existing voucher list, and what's the time period in which folks are having to wait for a voucher, right? And are we sharing that information with this community, with the folks on the voucher list? And then also, are we looking at, the scattered site model, also with hotels, motels, looking at the vacancy rates, and then going back to scattered site models? Are we looking at, the vacancy rates for landlord apartments that may be available?
Yeah, I appreciate you bringing that up. So a couple of things. We do have a large concerted effort. The people represented in this survey, for the most part, the centralized group discussing, evaluating time and resources is the coordinated entry system. And that's housed in my office, but so many of the people in this room are intimately involved in that. And we do see, lengths of time being longer and longer. The other thing is I know that, and we mentioned this throughout the meetings, permanent supportive housing is so incredibly important, but it is by far not the only type of housing we provide. And I know that we focus most of our time talking on it, but we do use vouchers, tenant-based vouchers that, obviously help people rent rooms throughout the community. We use rapid rehousing. We really understand that permanent supportive housing is in many ways, the most expensive option. So we prioritize and reserve the limited permanent supportive housing for those that absolutely need it. If they don't need that high level of care, that's where those tenant-based vouchers, rapid rehousing, some of the more short-term stuff is evaluated, and that happens through the coordinated entry system on a daily basis.
All right, seeing nothing else, we have an action item coming out of this. Madam Clerk, if you would read item 3 for us, please.
Item 3 is to approve the 2023 homeless survey for submission to the Board of Supervisors. And we have no request from the public to speak on this item.
All right, I'll entertain a motion. So moved by Commissioner Cornwall and seconded by Commissioner Parks. Discussion. Commissioner Spitzer.
I know that we have two supervisors here, but would it be helpful to have this discussion summarized and transmitted along with the survey so that one, the board knows that we discussed it, and two, that we also gave some direction and try to highlight some of the big rock issues, if you will, so that the board doesn't feel like it has to start from scratch and discuss it all over. In other words, we have a role, and I think the board should know that we did play some role. And I think it's going back to committee with further, in other words, put some context to the survey.
All right, so I will start with saying we will make sure that the minutes get transmitted along with this document. As it does come in front of us, I would expect Mr. Beck will be there and able to make a presentation and maybe more importantly, answer questions that any of us or our colleagues have. And so I would expect that absolutely would get done.
Great.
All right. Further discussion, seeing none, all in favor, say aye.
Aye.
Any opposition or abstentions, matter carries unanimously. I didn't want to miss this discussion, but I'm now late to another meeting. I'm going to ask our good vice chairman to continue the work he started so admirably earlier today. Thank you all.
Thank you. We'll now move on to the next item, Madam Clerk.
Yeah, item 4 is to approve the Commission to End Homelessness minute from the August 16th, 2023 regular meeting. And we have no request from the public to speak on this item.
Very good. The meetings are included there. Any discussion on the minutes? All in favor of approving the minutes, please say aye. Aye.
Can I please have a motion and a second first?
I'll make a motion.
I will move that we approve the minutes.
Okay, thank you. We'll now move to the next item, Madam Clerk.
Item 5 is to A, approve recommendations for appointment of the following candidates to serve on the Commission to End Homelessness to the Board of Supervisors for final approval. Including Adam Hawley, Chief of Police for the City of Brea as the Chief of Police Representative for a 2-year term. Dina Cunningham, Executive Director for Humboldt County as the Affordable Housing Development Industry Representative for a 2-year term. James Vanderpool, City Manager for Anaheim as the North Service Planning Area Representative for a 2-year term. Benjamin Hirsch, Director of Operations for the Salvation Army as the Faith-Based Community Representative for the balance of the 2-year term ending August 8th, 2024. And Milo Heineman, Executive Director for American Family Housing as the at-large member for a 2-year term. And B, to approve the launch of recruitment process and utilize the existing membership ad hoc committee to evaluate and make recommendations for appointment for the Medi-Cal Managed Care Health Plan Representative and the Central Service Planning Area Representative to the Commission to End Homelessness, and to be submitted to the Board of Supervisors for final approval. We have no request from the public to speak on this item.
Okay, Doug, will you please present this action item?
Yeah, I'll be brief. All the commissioners have an extensive briefing in their notes that really talk about the process and how we got to here. And I've outlined it on the slides here. We came to you all at the June meeting to launch the recruitment. That required that we had a membership ad hoc put together, which several commissioners sat on. We had the recruitment open from July 1st to 31st, and 24 applications we received. That membership ad hoc came out on the 21st of September. We went through each application thoroughly. We've communicated with all applicants the motion that we're making here today. So I also want to pause because there will be a handful of new seats or new members on the commission. Ben Hurst, who's replacing Nurse on Kiston, Adam Hawley, he'll be Chief Adam Hawley replacing Chief Dunn. But more importantly, this will be our last meeting with George Searcy, and Commissioner Searcy's been on the commission for quite some time. a complete leader in helping assist, I'll say at very least myself, manage through not only the commission, but the COC. And, Jamboree, the work's done at Jamboree is incredibly impressive. So I just wanted to take a minute to thank George for his time here on the commission. I also know, whether we like it or not, this doesn't mean it's the last time we've heard from George, and he's always going to be an incredibly critical partner in addressing homelessness here in the county. So yeah, I just wanted to pause to thank George for his time. And then lastly, we're launching the recruitment for the 2 seats. So, we're excited to launch the new seat for Medicaid Medi-Cal Managed Care Plan, and replacing the Central Spa City Manager legislation.
Okay, so there's 2 parts to this. Go ahead.
No, you go ahead and finish your statement.
Well, I was gonna say there's 2 parts to this motion. The first is to improve the recommendations for appointment of the 5 individuals that are listed here. And then the second is to approve the launch for the 2 additional members as Doug described.
So I'd like to address the first part, the recommendations. City managers are critical positions to get things done in government, local government. I mean, Frank Kim's the CEO of the county. The board, I'm fair to say, relies on the CEO tremendously to carry out the policy directions of the Board of Supes, for example. Mr. Vanderpool hasn't been here the last 2 meetings and maybe 3, I don't know. I just looked at the minutes. He's not here today. He's got a little bit of issues going on in the city of Anaheim right now. Maybe that's what's preoccupying him. I don't know. But there has to be full participation, and we can't have absences. So, I mean, we had Ms. Ridge, 1 meeting, city manager essential, North Spa, city manager, not here. Cold winter, the cold shelter discussion, like, we need our city managers to weigh in. They're the ones that will go back to the City Managers Association, which meets once a month, and say, hey, no cities responded to the county's letter. We need to let them know as commissioners. They need to take a leadership role with their other peers and colleagues. I mean, we have work to do and we have things to get done. So I am not all that interested in recommending Mr. Vanderpool for a 2-year term without any understanding of his commitment to this commission, or if he's going to show up. I mean, we can't have empty seats. I don't know what the alternate policy, I can't remember, but I mean, I sit on a lot of boards and commissions like you do. But I always make sure I have an alternate, so that if I'm not there, at least my office or our interests are represented, and then they can brief me. I mean, no one can make every meeting, but people have to send an alternate. So I don't recall, what is our policy on alternates?
So the only seat that has an alternate is your seat. And I think the history around that decision.
I didn't know that. No, not. We have the ability to allow for alternates, right?
I mean, difficulty, and I know the original thinking and reason why we don't have alternates is because it's important that this is an executive level commission and that those executives come. And with alternates, you run the risk of it being a meeting of alternates that,
I don't disagree, but you're making my point for me that if we have a vacancy of a city manager, when we need city managers and cities to step up, and we literally don't, we have 2 vacancies now. I guess my question, let me just, instead of keep arguing this, can we inquire of Mr. Vanderpool if he's still interested in participating?
Yeah, I can reach out to him, and I'm more than happy to. I also want to mention, he was represented on the survey ad hoc. From our understanding, he planned on attending today's meeting. Up until this morning, we were under that impression. I think he was here last time.
No, the minutes say he wasn't.
The minutes say he wasn't.
We just approved them, so that means he wasn't.
Yeah. So I'll I'm more than happy to reach out to him, and
Well, I'm really serious about it and I hope you'll support what I'm saying. I don't mind moving the recommended actions, but I'm not gonna support recommending somebody who has not been attending. That's not fair to any one of us and all the time we spend. So I would prefer to move all but little three, which is Mr. Vanderpool, with the respectful comment that until and unless we get an affirmative statement that he actually wants to serve and will be here, then I think we can absolutely pass it. But with this many absences consecutively, I personally can't support it. So I would just, look, and I'm not trying to jam anybody, but it's only fair. We're all here. And we do the best we can. So that would be, that's my point. I mean, I would amend the motion. Did you get a?
We did, so make your motion, I think.
So my motion is we approve A and B, but with respect to A, that it's little 1, 2, 4, and 5, and that we just hold a recommendation on Mr. Vanderpool until staff can confirm his commitment to attend these meetings.
So I'll second that with comment, and I do agree. I think the value of having a city manager here, especially from the largest city in the county, is really important. I think that's why my disappointment was so was so great for our city manager and not being able to just having both those cities are so impactful beyond with respect to homelessness. We would really value but I do know that again, when you're not present, even your alternate has a tough time even sharing what is happening here. And they can't make decisions, and you need people here who are going to be able to at least make that commitment. So I do agree. I think it makes sense. I think there are some other issues as well going on in Anaheim, but I didn't feel comfortable without maybe having further conversation with Mr. Vanderpool on seeing whether his availability, whether he can commit to the term that we expect all of our commissioners to serve by. So I'll be second.
Okay, we have a motion and a second. Does everybody understand the motion and the second? Is there any further discussion? Let's make sure that we have, go ahead, Doug.
I guess, so just to be clear. So when it comes to someone being appointed, this doesn't mean that he will not be able to attend the next meeting until. So, I'll put it there. So it's not like you're voting on today that if we go ahead with the motion that he won't be able to attend December's meeting.
For clarification, the new term for these recommendations is for 2024. Right?
The new term for this is starting in December. The current terms are set to expire like December 17th, one day before the next commission meeting. If they're not reappointed or their seat is vacated, they continue to serve the seat, even if their term has expired.
Okay, I'll clarify. If you can get clarification from him, given Supervisor Sarmiento's and my point, then terrific. Now he can serve under our bylaws, but he should be welcomed with open arms. I just think he should understand we take this very seriously, and a vacancy is a failure to show up 2 meetings in a row is a big deal.
What all I was trying to clarify is that your motion doesn't preclude him from coming in December, which might make people feel a little bit more comfortable with the motion.
I'll speak for myself. I wasn't uncomfortable at all about it, but the fact you clarified it probably makes him more comfortable, and that's fine with me.
Yeah, and I'm fine with that. My understanding of the motion was simply just to check in with him and to make sure he's able to make that commitment, given his recent absences and the fact that there's some other issues in the city. So I'm fine.
And probably I should clarify that for the next meeting, I would give staff direction to agendize it for formal motion, and then we can take it up to ratify it then.
Yeah, that's what I understood, that we would be pulling that seat, and that would be an action item to look at in December.
Effective immediately. Great, thank you.
Everybody understand the motion? Any further discussion? Thank you for bringing that up, Commissioner Spitzer, and for the second, speaking on my own personal behalf. Thank you for bringing that up. Any other further discussion? All those in favor of the motion, please say aye.
Aye.
Aye. Any opposed? Passed unanimously. Thank you very much. Thank you. We'll now move on to the next item, Madam Clerk. Oh, please.
I'd like to abstain because I feel like I should be voting for myself. So,
Very good. Thank you, Milo. Thank you.
Thanks.
You read the next item, Madam Clerk?
The next item, number 6, is to establish an ad hoc to evaluate alternative housing solutions, including studying, defining, and identifying potential applications for tiny homes. And we have no request from the public to speak on this item.
Not on this item, in a tiny way, please.
Yes, in a very good way. So we're excited to bring this ad hoc forward for vote. There's been a lot of discussion, a lot of interest around tiny homes. It is a sort of really open term that means so many things to so many different people. People are excited because often tiny homes means faster, faster to move in and cheaper process, but yet again, they have so many different applications, and I think this is a chance for the commission to study tiny homes, bring back to this group to say, hey, when we talk about tiny homes, this is what we're talking about, this is what we mean, and help provide some boundaries and definition to it. Because I think it is a term that is used often, and it makes it difficult to have an opinion on when there is not an understanding of exactly how people are defining it when they use it. So I think this would be a great ad hoc.
Okay, management is recommending the formation of an ad hoc to study alternative housing, including tiny home.
I'll move it.
Motion made. And a second, Commissioner Parks. Any further discussion?
Are you looking for volunteers?
You can contact my office. Ad hocs are seated by the chairman.
Further discussion? All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? Right, very good. This concludes our agenda items for today. We will now move to general public comments.
And Vice Chairman, we do not have any request from the public to speak under general public.
Great, thank you. Thank you. We will move on to commissioner comments. Hearing none, that concludes this meeting of the Commission to End Homelessness. We are now adjourned. Our next regularly scheduled meeting will be held Wednesday, December 13th at 1 p.m. Thank you very much.
Thank you.